testing?
I recommend allergy testing if the symptoms of your allergies are interfering with your daily lives. If you have asthma and you're getting flare-ups because of that, people that have recurrent sinusitis, sinus infections from having allergy problems.
So if you're just miserable and you want to get tested, are there different ways to do that?
There are different ways. Our office does offer a blood test that checks for common basic food allergies as well as environmental allergies. And then there's also tests that you can get through the allergist, the specialist, which would entail typically multiple shots on your skin, usually your back.
And you look for a reaction either in the blood or on the skin to tell what you're allergic to.
Right.
Okay. So let's say you're allergic to XYZ. I mean, how much do you have to be allergic to think, well, I'm going to get allergy shots, and what's the commitment with that?
Well, that's a good way that you put it, XYZ, because really, unless someone in those panels of blood tests has at least a few significant allergic reactions, then they really wouldn't be a candidate for the serum. So you would want to have at least 3 or more significant positives before you would think about getting injections, because injections can be up to once or twice a week for sometimes years.
And there's potentially side effects to injections.
There are side effects, however, it is a safer route to treat allergies through immunotherapy, which is basically injections, than in other forms that we sometimes resort to in a pinch, especially.
Other forms?
Such as allergy or steroid shots, steroid pills. Steroid nasal sprays are fine, and even children use them, but
there are prescription allergy medicines too, antihistamines, that you can't buy over the counter.
There are. Typically, the ones that are prescription are going to be, you're going to pay for convenience of dosing. They'll be once a day, and a lot of times they are brand name, but there are good ones. There's, for instance, the newer type of nasal spray is called Dymista, and that's fairly effective and covers not only the antihistamine side of treatment, but also the steroid side of treatment.
And you mentioned steroids. That is, when all else fails, you can use those.
Yes. They'll work fairly quick. You can get an injection that can last for up to 8 weeks, and there are also pill packs that you can take, but that's just a temporary relief, and long-term use of anything in forms of a steroid isn't recommended unless the benefit outweighs the risk.
Well, that's great information. Thanks for coming in.